I want to share some information that I believe every woman should know. It's information that I wish I had learned as a kid. I wish I had learned in medical school to teach my patients. And I had to do my own research because of some other issues to find out this information. So here's the deal. There are going to be 3 times in your life where your body is actually going to make you gain weight. Okay, so your body goes through something called physiological insulin resistance. Now, you've heard of insulin resistance as it pertains to diabetes, maybe PCOS, obesity, things like that. But there are times where, as a woman, your body's going to make you go through a period of insulin resistance. And you need to be in insulin resistance to gain weight, right? And so the first time that this is going to happen is during puberty. So during puberty, you're going to be gaining weight in certain areas, your hips, your thighs, your buttocks, all of that. And that's because your body is being prepared for pregnancy. So that's the first time that you're going to start gaining weight, and your body's going to be in a state of physiological insulin resistance. Now, from the time of 1 to 12, for example, if you have your period at 12, if you're not eating healthy, so eating whole foods, staying active, there's a good chance that once you hit that physiological insulin resistance, you're going to have issues, right? You're going to start having acne. You might start to notice that you're having things like hirsutism, so facial hair on your face or your chest, things like that. And so that's like a little warning, like, hey, you were already insulin resistant during that puberty stage, and then now puberty has come and has added to the insulin resistance, and so now you're starting to see signs of insulin resistance on your skin. The second time that you're going to see insulin resistance is during pregnancy. Again, this is a time where your body is making you gain weight and is taking all the glucose that you're eating and is giving it to the baby to grow the fetus, right? And so if you've ever had a baby or had gone through pregnancy, we have to do these glucose tolerance tests to make sure that we don't develop gestational diabetes. And it's because during pregnancy, your body goes into a state of physiological insulin resistance. So again, if from the time of puberty all the way to the time when you're having a baby, if you're not eating healthy, your BMI is not at a healthy range, you might then have gestational diabetes, right? Where maybe you were insulin resistant during that time, but you were not having any symptoms of it. And then now your body adds stress to it. Well, your body goes through physiological insulin resistance, and then boom, you have gestational diabetes, or maybe you develop high blood pressure, things like that. Okay. And then if you have multiple pregnancies, then you're going through a period of insulin resistance that's even, you have more insulin resistance that's coming up, right? And then the third thing is that when you go through menopause, you also go through insulin resistance. So when you're going through menopause, your estrogen levels are going to go down, your progesterone levels are going to go down, and progesterone helps you sleep really well. And so now you're having issues with sleep, and when you're not sleeping, your cortisol levels go up, and when your cortisol levels go up, you're going to be insulin resistant, right? And on the other side, normally you have estrogen, and estrogen makes you gain weight or hold weight in areas such as your hips, your thighs, your buttocks. But when estrogen goes down, now your body's going to start storing weight in your stomach area and your visceral fat, and that is also going to promote more insulin resistance. So throughout your life as a woman, your body is going to make you gain weight. Your body is going to put you in a state of insulin resistance. And so it's your job to do your best to eat and be as healthy as possible, because you can't really avoid some of these issues. Now, you may not have kids, but you can't avoid puberty and you can't avoid menopause. And so those are like the times when your body's just going to throw you in for a loop, and you have to be prepared for that. And I don't know, but I wish someone had really explained that to me or to anybody, because it would have explained so much. I really found out about all of this because I was struggling to lose weight after having kids, and I was like, what is going on? I could lose weight so easily before, and why is this happening? And that's when I learned more and more about insulin resistance. I'm pretty much obsessed about it right now. And yeah, so now you know that your body as a woman puts you in a state of insulin resistance 3 times And so you just need to be prepared for it. And I hope that you share this with every woman that you know, because I'm sure it's going to explain a lot of things to people who are like just trying to figure out like, why the hell is this happening to me?